Good morning, students. Filariasis. Sign and filaria is parasitic disease caused by infection with roundworms of the filariasis types. These are spread by blood feeding black flies and mosquitoes. This disease belongs to the group of disease called helminthiasis. Sign and symptoms. The most spectacular symptoms lymphatic filariasis is elephantiasis, dumb with thickening of skin and underlying tissues, causes human filariasis normal form and complicated life cycle. Treatment. The recommended treatment for people outside the United States is yellow fever. Yellow fever is viral disease of tropically short duration. In most cases, symptoms include fever. This disease is caused by yellow fever virus and is spread by the bite on an infected female mosquitoes. Safe and effective vaccine against yellow fever is available on some countries requires vaccination for travelers. Other of the prevent infected include reducing the population of transmitting mosquitoes. Prevention and treatment given in is here. Meningitis. Meningitis is an acute inflammation of protective membranes covering the brain and the some forms of meningitis are preventable by immunization with sign and symptoms. Hepatitis. There is different types of hepatitis. Hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. Symptoms. Initially, symptoms are mild fever, muscles or joints agnosis, vomiting, loss or appetite. Prevention. Eat only freshly cooked food. Get a hepatitis vaccination to prevent hospital BCD. Practice safe sex. Do not allow yourself to be pierced with non-ethical equipment. Give the hepatitis B vaccination treatment. There is no specific treatment for hepatitis. A man caused hepatitis are resolved themselves. Encephalitis is an acute inflammation, swelling of the brain. Usually, in medicine, acute means in the most types. Japanese thick bond, less common symptoms. The medical individual may also experience in nasal residually symptoms, main especially as fever, headache, and photophobia. More serious cases. Sign of symptoms in infant. Initially, encephalitis is harder to detect in young children, and beside parents or guardians, causes encephalitis can develop as a result of direct infection to the brain by a virus, bacterium, fungus. Treatment. The for encephalitis focus on alleviating symptoms. There are only a limited number of reliable diagnosis. MRI scan and brain diagnosis increases. Childhood virus including measles and mumps. Secondary encephalitis diagnosis. A CT scan may be useful in detecting change in the brain structure. It also rule another causes. EEG, electroencephalograph, monitors an electric activity of the brain. The doctors might order a blood test if a West Nile virus infection is thought to be the cause.